Hello, friends. If I tell you that I'm going to operate on a tumor in the brain through nose without making any cuts, do you believe it? May not. You may think I'm speaking about science fiction. No, it is not so. Now, we can operate certain brain tumors via nose without opening the brain, which or skull, like how we used to do before. This is called as endoscopic skull-based surgery. Most commonly, pituitary tumors are the one we operate through the nose. Pituitary tumors are unique tumors which is arising from a pituitary gland which is situated at the base of the brain or skull we can call. This is one of the master glands as we call. It is responsible for almost all the growth and development of the body. Some people you may see are gigantic in proportion. Such people may be harboring pituitary tumors. Or it is very common in ladies presenting as, disturbed menstrual cycle or not having child like infertility, etc. When they are evaluated, they are found that to have some of them to have this pituitary tumors. Apart from that, it may not secrete any hormones, but because of when it grows, it is close to important structures such as optic nerves, that is the nerves from the eyes. Patient may develop visual disturbance. They may say, I can't see in the sides, or while driving, I have hit against something, pillar, or pole, etc. And these people are evaluated by scans such as MRI. They find to have pituitary tumors. Many of such pituitary tumors need surgery. Before, we used to operate by doing what is called as craniotomy or opening the skull and reach. This often used to lead to complication because we have to go through the normal brain or retracting the brain. Now, we have found a way out. That is, we operate through what is called as endoscope. That is, it is a small, long tube, as you see here, which is connected to a camera system, and we can see pass it through the nose, separate some structures in the nose and reach the tumor and remove it effectively. Incidentally, this system was co-developed by an Indian, and after this tumor is removed, there will be a pack in the nose and for 2 or 3 days, and afterwards typically the patient will be discharged. He may have some nasal discharge, secretions, or blockage of the nose. We'll give him some drops to keep his nose clean and moist. These patients also have to take care that they may have some water imbalance, like they may have increased thirst, increased passing urine, or sometimes even salt imbalance. So such patients need to be on a close follow-up. This is a typical setting which you are seeing where we are operating some nose. As you are seeing, we are passing one guide, what is called as navigation guide, which will exactly pinpoint during surgery where we are, like a GPS system. This is an advanced gadget we have in our hospital, in Chinmaya Mission Hospital. And this is one of the examples of how we are operated. You see on the left-hand side, a large tumor, which is almost burrowing into the brain. And after surgery, almost complete tumor is gone. Similarly, this is one of the tumors which we operated. Because of a special two-surgeon technique we delicately remove the tumor, preserving the normal pituitary. Hence, such patients, after some few months, regain their hormonal function. We have found out more than 70% need not be on long-term hormonal replacement. That is the unique feature of this surgery. And this is one of a lady, a medical student, who came with a tumor, what is called as Cushing's. She came with behavioral changes, obesity, etc. And when evaluated, found to have a tumor. We operated on her now she is practicing and doing very well. And that is the beauty of this tumor. And if you, on evaluation, you or your relatives have this, don't get worried, because with correct treatment you can do well. Thank you very much.